Hello, and welcome to another episode of the Healthcare is Serious Business podcast series, where we unpack the complexities of global health and the challenges, of operating a healthcare business across different continents and across different markets. I'm your host, Ezinne Aso. I'm very passionate about this, and my job here is to help you to demystify some of the knowledge, some of the information you've heard about doing healthcare business in the continent of Africa. We hear it all the time: improve access, access this, access that, access that. Access means different things to different people based on how you're viewing it. For a woman who might be located in an underserved part of the country or part of the world, she might see access as, okay, I want something very cheap and affordable. Another person might see access as, okay, I want medicines, perhaps for name medicines and things that we rarely find, rare disease and stuff like that. Access can be making sure that those drugs are available in continents or in regions where less than 1% of the population have such conditions. So today we are demystifying access for healthcare solutions in the continent of Africa. Now, we often reduce access for healthcare to different things, like I said, proximity to a clinic. It could be that, okay, I want free services or free clinic services, free medicines, and stuff like that. I always go back to the story of why I chose to build my career around, medicine access and also pharma. Yes, I'm a pharmacist by profession, but in let's say halfway through my pharmacy profession, I was like, nah, this is not for me, nada. I have to figure out my next best step for my career. And so I was almost pivoting into finance until I had an experience with a patient who kind of like, will I say, like gave me a strong why on why I should stay in the pharma space. And this particular patient, brought tears to my eye because at the time she didn't have, any condition that was like different or things we do not know. She just had diabetes, and I wonder why it was so difficult to care for her or to find the medicine that she needed for her condition. Now, my patient is from, let me not say a very poor background, but let's say she's from a middle income background, and the doctor had prescribed her a very high cost insulin brand that she was supposed to use to treat herself. But unfortunately, because she didn't have the right information, let's say first of all, and also she didn't have the funding to be able to purchase that insulin commodity, her condition grew from bad to worse. Like literally, she developed diabetic neuropathy, which is like a condition that causes you to lose your feet or lose the senses in your foot. You have wounds in your foot and they cannot be treated, they cannot be healed because of the blood, the high level of glucose in the blood. And that was the case of this patient, Ashame. And interfacing with her made me realize that there are millions of patients all over the world who do not have access to the right information and also access to the right, consultation services that will help them to manage their ailments better. So yeah, and interfacing with that patient made me think about, okay, isn't it, you need to do something about this. What can you do about this? And funny enough, all my career without even, that silent wish in my heart has led me through the different journeys and paths I've been through. Most recently just wrapped up my MBA, and I'm looking to, pursue this full time in terms of like helping people get access to the right treatment that they deserve. So yeah, let's go back to the question about what really is access like in Africa. A lot of people feel like in Africa, people, depend solely on donors. People depend solely on, the healthcare system, like the government services. But, statistics have it that 60% of all medicines and healthcare services purchased in the continent of Africa come out of pocket. So basically, financing is one of the things that define and is a major chunk of the healthcare statistics in the continent of Africa. And this is not just for one country, this is all African countries. Now, one of the current, let's talk about the current state of access in Africa. One of the biggest statistics we have is that 50% of Africans lack access to essential medicines. And whenever I think about this, I think about the huge opportunities that exist for people who are looking to launch healthcare businesses. I'm certainly looking at the stock prices and the stock performance of a number of pharmaceuticals in Nigeria. And I was super impressed, the growth statistics despite the challenges that we have in the economy. A lot of people are sleeping on the pharmaceutical sector in the continent. You can see that we have still yet 50% of our healthcare commodities and medicines that we need for our population being imported from surrounding and neighboring continents and even faraway continents across the globe. And that's why we need to see that there is a lot of opportunities for us to come in to do something in this space. Another key statistics that we also need to mention in this is that healthcare workers is far below the average. And as a healthcare person and someone who is really into digital health and also thinking about healthcare strategy and forward thinking about the healthcare system in the continent of Africa, I always think about this as a big opportunity. Yes, we have a lot of brain drain in terms of our healthcare workers leaving the continent for greener pastures in other climes across the world. But this is a big opportunity for us to sit down and think about how do I really innovate and make sure that patients are able to access the clinical care and the services that they need. In a very fast-paced developing world as we live in today, the advent of AI, machine learning and technology cannot be set aside, because this is unlocking opportunities across different industries, and the healthcare system cannot be left aside. There is no doubt that the African healthcare system still needs to come back to the drawing board and think about what works, because the truth is that technology is not all that we need. Sometimes a low-cost solution can be the difference between healthcare services and what we really need to serve our population. And that's why we need to come back to the drawing board to think about what does my population need and how can I serve them better using technology to scale access to healthcare services. So this is very, very important, because I'm seeing that in the next, I call myself a healthcare futurist because I am. I'm seeing that in the next 10 years, there will be a lot of advancement in terms of like digital health solutions in the continent. We're not there yet, because monetizing is one thing. Having a digital health solution is also one thing. Monetizing and being a profitable business, and like you all know, health is serious business. I'm all for the profit side of healthcare and not just the social good that comes with developing solutions. We do have a lot of potential for digital health innovators and people who are building solutions for both um diagnostic services, financial services, imaging, and scheduling services for patients to be able to meet with clinical providers. So this is a very big opportunity that I feel we cannot underlook. Another one is that Africa is very large, and Africa is not just one country. It's a lot of countries in Africa. We have over 52 countries in the continent of Africa, and there is a lot of rural, underserved communities. We always, when we talk about innovation, we always think about the big people, the people who are living in the cities who can afford to pay for an app solution or for a hospital visit. But we must understand that the continent of Africa is a low income country, and a lot of people are living below the poverty line in the continent of Africa. That said, there are still opportunities for us to innovate and also develop solutions that will be able to serve this segment of the population because they're very, very important to us. The rural communities are very, very, how will I call it, in terms of like the vistas, cities, and urban centers, they are very, very far apart. And that's why we need technology. That's why we need people who are smart enough to develop low cost tools that will be able to support people people who live in this segment of the population to access care that they deserve. We can't take aside the part of, when a mother needs to push her baby or give birth. We can't take away the side of, when a patient falls sick. But there's a lot of opportunities for us to reduce the number of wait time in hospital services that comes from just routine checks and, routine screening that, can be easily done leveraging technology. So this is one area that I feel like we need to understand and demystify. Another segment I would like to talk about is, I think I've already touched about, is that we know that 60% of the healthcare financing for the continent comes out of pocket. There's been a lot of frenzy that comes with the aid cuts that has happened recently with the pullouts for major donors to the continent, and this has caused a lot of fret. I'm a little bit on the other side of thinking about how we can navigate this very, very unique situation, because I see as someone who has worked in the private sector for over 4 years before coming for my MBA, I've come to realize that there's no need to fret. We all need to come to the table to think about how do we, bring the debt structuring in a way that, even if we have to get foreign aid and debt, we do it in a way that it's innovative and we're able to pay for it by ourselves based on the income and the return that comes from investing in this, innovative financing model. I feel like when I was younger, innovative financing model sounded like a cliche to me because it felt like we're just always talking about how we're going to bring money from the table, 3%, 3:1, and the 3% always had to come from the donor. But going through my MBA program and researching a lot within the Johns Hopkins University, I've come to realize that most likely should not be the case, because innovative financing mechanism is also thinking about how do we, build a self-sustaining system that will be able to make funding available for this particular healthcare need that we need in this six segments of healthcare solutions. I'm give vision, but basically what I'm just trying to say that is achievable. It's just beyond cliche. It actually is something that we can talk about, and we can actually implement in the continent, regardless of whether the foreign aids have been cut or not. Now let's talk about what's holding us back. What is holding us back in terms of like scaling access for healthcare in the continent of Africa? The workforce shortage is a reality that we cannot underlook, or say we cannot bypass. There's been a lot of brain drain in the last years, with a lot of healthcare workers leaving the continent due to burnout, lack of trainings, and a lot of gaps in terms of like healthcare workforce being brought up to date with best practices across the globe. We have doctors who have trained in the last 5 years, 10 years, and they are not brought up to date with what's happening in the world. And that's where we also need to think about how do we leverage technology to scale and also to train our healthcare workers for the continent. Another area we need to talk about is also the weak primary healthcare infrastructure. I can speak to Nigeria. Nigeria has a lot of primary healthcare centers over across all local government, over 700, even more than close to 1,000, if I'm not exaggerating. But the functional ones, the ones who are functionals, are very limited. There are a lot of gaps in terms of like access to electricity, essential equipment in these facilities. And this is where I feel like the government needs to sit down and think about how do we bring in the private sector to support us with developing low cost models, right? Low cost equipment, low cost technology that can be deployed to this primary healthcare center, because obviously the primary healthcare center is supposed to be the first point of treatment. If we have a functional primary healthcare center across Africa, the burden of the diseases, the burden of on the secondary healthcare sector, and even the healthcare workers will be reduced to drastically. So I feel like this is something that we need to address that is holding us back. Another aspect is the supply chain disruptions. There's a lot of stock out for essential medicines and diagnostics in the continent. I was reading a report recently, and I was just really disgusted about how there's been a shortfall of supply for essential medicines. And these are things that can be easily produced within the continent, but yet we still have to wait for importation across India and other markets across the globe. We need to wake up, and this is an opportunity I feel like investors should look into. Even having just basic syringes, basic equipment, BP machines, we can actually produce them locally. That these are things that we need to opportunities I feel like are very, very much needed right now in the continent. Another area that I would like to talk about is the policy and the regulatory front. There's no way we can talk about access or scaling access if we do not talk about the policy and the regulatory front. There's a lot of regulation across the Federal Ministry of Health or the Ministry of Health across the different markets in Africa. But we need to align the framework that allows for private sectors to come in to be able to support healthcare systems in the continent. Yeah, financing misalignment, we need to bring back to the board, and healthcare needs to be prioritized. We need to make sure that we flag this as a national priority across the continent, and not just a national priority, a continental priority. And we don't want what happened during the pandemic to happen again, where we were scrambling for supplies of commodity. We didn't even have knowledge about what we had in the continent. I feel like these are opportunities that we need to address as a continent, to be able to scale access. Now let's talk about about what's working, because we've talked about what's not working, but we need to talk about what's working. There's a lot of things that are happening right now on the continent that I'm very excited for, particularly work within the African Union in terms of like the pharmaceutical sector. The African Union is doing a lot of great job. I mean, we all need to pay attention to what they're doing, because it has the potential to change the landscape, and improve things for the better for the continent. There's been a lot of consensus in terms of like bringing key markets to be able to pull procurement for essential medicines. However, given the current state of aid cuts, we need to actually attract a lot of private sector investment to the pharmaceutical sector. We need a lot of factories. We need a lot of plants that will be able to produce the drugs that we need. There's no telling it. The future is Africa. The future is the continent of Africa, and that's why I'm very, very passionate about ringing the bell and sounding the alarm for people who are interested in investing in the continent, that the pharmaceutical sector right now is the best place for you. The imaging sector, the diagnostic sector is the best space for you right now, because I assure you that you'll make profit, you'll make money back, you have a lot of return on investment. You should just speak to experts in the space. I'm always here to consult for you if you're also looking to launching something in the continent of Africa. There is also the part of insurance innovation. The African continent, the insurance market we have in healthcare is not well structured, or let us say not well structured. Well, maybe I'll rephrase that. We need to actually rethink the insurance policies for healthcare, and that will also make it affordable for all people, all segments, both the low, the high income, and the middle income, earners in the continent. I feel like there's a lot of space for health financing innovation in the continent, and I think that the private sector, because the public sector has struggled a little bit on this, particularly in terms of like private health insurance. I feel like this is the part where we need to think about how we bring the private investors to think about investing for private healthcare financing. I feel like this is working in some markets, but we need to think about it better. Another part that I think is really working in the continent is the telehealth platforms. There's been a lot of telehealth platforms. I can't speak right now to profitability, but there's been a lot of successful private sector telemedicine platforms in the continent that I believe shines bright spots for the future. Yes, we're not there, but I believe in the next 10 years, this will be bright spots for the continent. There's room for a lot of, global partnership and partnership for, both private, public sector, and donors to be able to think about, how they come into the continent to invest. I'm big on partnership because I worked as a private sector consultant for Clinton Health for a while, and I've come to realize that there is so much we can do when we come together on the table, and that's why I'm inviting you to rethink your investment in the continent. Reach out to me, reach out to anyone who is on the ground that can give you local context about the continent. I just want to end with this. Access is not charity. Infrastructure, intention, and investment are very, very important. And when you want to invest in the continent, always remember that it's not just one country, it's 52 countries in one continent, and they are very unique markets, and that's why you need to tailor your intervention. A lot of people, a colleague of mine who I had as a guest on the podcast has said, and I quote him, a lot of investors coming in with I have this is what I want to do in the continent, this is what I think would work, but they don't really come with that humanistic mindset that I want to hear from the people on the ground. So having local context from people who are already playing in the space, or people who have worked on the space, is very, very important to save you cost and also to save you time. And that's why I believe that the African continent is somewhere that you would definitely benefit from, because the future, like I said, is Africa. I'm always here one day to guiding you and also giving you that local context you need to understand about the African market. So thank you so much for listening to the Healthcare Serious Business podcast series. My name is Ezinne again, and I'm the host of this podcast series. I'm very excited about what we're building here, because the future is healthcare, the future is Africa, and I want you to keep keep in touch with this channel because we'll keep talking about different markets across the globe and across different continents beyond the African continent. So till we meet again, stay bold, stay curious because the future is Africa. My name is Ezinne again and have a great one. Bye.